Good afternoon, guys. I've got discussion A for you. Now we're discussing uh, a condition that people get after heart surgery. For some people, it's a short-term um, condition. Sometimes, for people, it takes longer to get over. But it's the name of it is called the cardiac blues. So I'm going to go through that and tell you what that entails. Um, Tell you how long it lasts for people, things of that nature. So please join me for today's A. Here we go. For most people, having heart attack, or requiring heart surgery comes with a huge shock. It makes you realize you're not immortal, which can be extremely distressing and upsetting. Most people experience changes in mood and emotions after their cardiac event. This is known as the cardiac blues. When you leave the hospital, you might find yourself on an emotional roller coaster. Some people feel angry, irritable, and frustrated. Some people feel sad, distressed, and depressed. Some people feel anxious and fearful and worry about whether they will fully recover. Some people feel all of these things. These common emotions are listed below. Common emotions associated with the cardiac blues, emotional symptoms, shock. You might find it hard to believe that you've had a heart problem. Denial, you might find it hard to accept that this has happened to you. Worry and anxiety, you might worry that you will never get back to your old self. You might be fearful about dying. Sadness and depression, you might feel low and miserable, or your mood might be up and down. Frustration and anger, you may become frustrated and irritated about the change in your life. Guilt, you might feel guilty about being dependent on or blame yourself for what has happened. The cardiac blues also brings a number of changes in your behavior and thinking. Cognition, as listed below. Many people think the worst and worry that things will never be normal again. Common behaviors and thoughts associated with the cardiac blues, behavioral symptoms, cognitive symptoms, loss of interest in usual activities, confusion and forgetfulness, withdrawal from others, irritability to inability to concentrate, getting tearful and crying easily, bad dreams or nightmares, being short tempered, difficulty making decisions, sleep problems, worry about another heart event, changes in appetite and sex drive, thoughts about death is normal to go through the cardiac blues. The emotional, behavioral, and cognitive aspects uh, of the cardiac blues are all common. Almost all people get the cardiac blues. This is a natural and normal part of having a heart attack or heart surgery. How long will it how long will the cardiac blues last? The good news is for most people the cardiac blues go away in the first few months after the cardiac event. By around the 2-month mark, you will start to get back to your usual self, and things will begin to get back to normal. Is the cardiac blues the same as depression? Depression is different uh, to the cardiac blues. The two key features of depression are profound feelings of sadness most of the time and lack of interest or enjoyment in most activities, including activities that you enjoyed prior to your heart event. Some people have thoughts of suicide or self harm. 1 in 5 people go on to experience severe depression after a heart attack or heart surgery. Depression makes people less able to look after themselves. People who become depressed in the year after a heart event are less physically active, more likely to smoke, have less healthy diet, are less likely to take their medication as prescribed or go to cardiac rehabilitation, and have worse health outcomes over time. 3 and 4, it is important to get help if you believe you are depressed. How do I know if I have the cardiac blues or if I'm just if I'm depressed? It is difficult to know whether you have cardiac blues or whether you are depressed, as the symptoms of the cardiac blues and depression appear very similar. These are two ways you can distinguish between the cardiac blues and depression. Time since your heart attack event. The cardiac blues should resolve in the first 2 months. after your heart event. By 2 months, your mood should be getting better. If you are still experiencing mood difficulties 2 months after your cardiac event, then you may be depressed. Red flags for depression risks. There are some red flags that can tell you whether you are at increased risk of developing depression. After your event, these are listed below. If you're tricked to, if you're, if you tick 2 or more red flags, you might be at risk of developing depression. Red flags for increased depression risk. You are at increased risks of depression if you have had severe anxiety or depression in the past before your heart event. You are under 55 years of age. You are isolated or live alone or have no one to talk to. You have financial worries. You have been stressed at home or work or have lost your job. A loved one has died recently, or if you're having if or you have recently divorced or separated. You regularly use cigarettes or drugs or alcohol. You have diabetes or other major health problems. uh, Regaining control with ease. Having a heart event can make you feel that you are not in control of your life anymore. 7. The EASE model provides 5 key tips for improving your mood and regaining control of your heart event. It is important to have a combination of enjoyment and achievement activities to have strong social connections, a regular sleep pattern, and to exercise regularly and eat well. Use the EASE model to help regain control of your life. Enjoyment activities. Enjoyment activities are relaxing and nourishing and nurturing and give you a sense of pleasure and joy. Achievement activities. Achievement activities are more challenging and difficult and give you a sense of competence and confidence in mastery, social connections. Spending time with others gives you pleasure, helps you feel better, provides support, and makes you feel that you belong. Sleep is commonly disturbed after heart event. One of the best ways to feel better emotionally and physically is to have a good sleep pattern, exercise and eating. Exercise gives you a feeling of well-being, improves your mood and reduces depressive symptoms. Healthy eating is important for both physical and mental well-being. A final note: if you are concerned about your emotional recovery, or if you think you might be experiencing anxiety or depression, make an appointment to talk with one of our registered cardiac counselors in our cardiac counseling clinic. We offer effective treatments for anxiety, depression, stress, trauma, and post traumatic stress, which will improve your mood and quality of life. You can find out more by visiting our website, australiahealth.org/au. Okay, guys, so that is A for you. I'll be back on shortly with B. Give me a bit for B, please, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.